All right, it is 8:01. We do our best to get started on time. Hello, everyone. Thank you so much for being here. My name is Colleen Smith, and I'm part of the communications team here at True You Weight Loss, and we are just so excited that you all signed up to spend the evening with us. We're here tonight to learn all about ESG with Dr. Lauren Donnangelo and our Director of Health and Nutrition, Laura Sebring. Dr. Donnangelo is going to kick us off in just a few minutes, but I wanted to start with a few small housekeeping items. This session is designed to include just a brief presentation of the ESG procedure, how it works, who's a candidate, what to expect before, during, and after. And at any time throughout the presentation, you're welcome to submit your questions using the question and answer function, but we will wait until the end to answer all the questions just to make sure we have enough time to get through the presentation. If you need to leave at any point in time during the webinar, that's perfectly fine. We'll have a recording of the full session to share after the evening via email. So that is it for now. I am going to punch it over to Dr. Donnangelo, who is going to kick us off.
All right, thanks so much, Colleen, and thank you everyone for joining us tonight to learn a little bit about ESG, which is the endoscopic sleeve gastroplasty. Again, I'm Dr. Donnangelo. I'm one of the bariatric endoscopists at True You Weight Loss in Atlanta, and I'm joined by Laura Sebring, who's one of our outstanding dietitians. So we'll go ahead and jump right into it. So really the first thing to address would be what does endobariatrics actually mean? So you might hear the word endobariatrics and endobariatric therapy or bariatric endoscopy. And essentially, this is the most effective, minimally invasive, non-surgical procedure that we currently have available to treat obesity. These procedures are performed by physicians. They are conducted while the patient is asleep under anesthesia, and they're designed to support safe and long-term weight loss. There are two basic categories of endobariatric procedures, and they're really divided into patients who have had no prior weight loss surgery. And so those two main options are the ESG procedure, which we'll talk about now, as well as the intragastric balloons, SPATs and Orbera, and we'll have subsequent webinars on those in the future. We're just going to focus on ESG tonight. And then the other category is patients who have had prior weight loss surgeries, such as a sleeve gastrectomy or a gastric bypass surgery. And we also have minimally invasive procedures that we can perform for those patients if they regain weight after those surgeries. But again, those are for another talk. So importantly, how exactly do we perform the ESG? So again, the ESG is a minimally invasive procedure, meaning we're not making any cuts or incisions into the abdominal wall, and there are no scars. So we basically do this by inserting what's called a gastroscope, which is a thin, flexible tube with a light and a camera. And we also have a suturing device, which is a stitching device that you can see up there in the upper right-hand corner. Basically has a suture needle and a piece of blue suture on there. We insert that through the mouth while the patient's asleep. We go into the stomach, and we basically use that tool to plicate or bring together the folds of the stomach in order to create a shorter, smaller stomach. So we essentially cinch the stomach folds in and cinch the stomach into a smaller configuration that you can see there on the right. So before the procedure, when your stomach's full, it's about the size of a football. And then after we're done with our suturing procedure, your stomach will be about the size of a banana. So these are a couple of pictures just to give you a sense of what we're looking at when we go into your stomach. So these are photos from inside the stomach. The gray kind of metal material that you're seeing there, that's our suturing device. And the blue string you see in the middle, that's one of our actual sutures. So the photo all the way to the left, that's your stomach prior to ESG. It's kind of hard to appreciate, but that stomach is pretty wide open and dilated. The middle photo shows the stomach immediately after we perform an ESG. So you can see the folds of the stomach are really tightly brought together and cinched together in a nice tighter sleeve conformation. And then the picture all the way to the right is the stomach about a year out of ESG. And you can see that the lining is really well healed. And if you can appreciate how narrow the stomach is, it's kind of hard to tell in a photo, but if we were to drive the scope through that stomach, it would be really tight. And that's a really nice tight sleeve and a good result. So we've done the ESGs, but how exactly does this work in order to help you lose weight and feel less hungry? And so ESG really works via two main mechanisms. So those two mechanisms are called satiety and satiation. So what is satiety? Satiety is basically how long we stay satisfied after a meal. And basically the stitches that we put in, the suturing and the shrinking of the stomach, delays the stomach's emptying. And so after you eat a meal, food will hang around longer and you'll feel fuller for longer before you're looking for your next meal. So that's one part of the equation. And then the second part is satiation, which is essentially how satisfied we feel while we're eating a meal or during a meal. Because the stomach is a lot smaller after our suturing procedure, you'll tend to eat a lot less, and the stomach will sense that stretch and you'll feel fuller during the meal, and that will lead you to consume fewer calories during a meal and then ultimately lose weight. So those are the two main mechanisms. It's important to note that ESG doesn't affect the production of ghrelin, which is one of the hunger hormones. That hormone is produced by cells in the fundus of the stomach, which is kind of the top upper part of the stomach. We don't touch that area. A surgical sleeve procedure, they remove the fundus. So that's a key difference there. Our procedure works via satiety and satiation as opposed to ghrelin. So here's the slide that everyone cares about. It's the weight loss outcomes. It's obviously a very important part of what we do. So you can take a look at the chart there with their starting weight in pounds over on the y-axis, and then you can kind of look at the total body weight loss over 3 to 36 months. In general, in the published ESG literature, you can expect to lose about 15% of your total body weight. But in our practice, because we are so high volume and we have such expert endoscopists and such fantastic follow-up, our patients tend to lose on average 20 to 21% of their total body weight. And then I think one of the even more important parts of this slide is, we all know that it's difficult to lose weight in the first place, but it's actually even more difficult to maintain. But if you look over to the left side of this chart at month 24 and month 36, our patients in our practice are maintaining that 20 to 21% weight loss, which is really, really impressive. And then it's not all about the numbers. So there are also a lot of non-scale victories that we like to celebrate with our patients, particularly the health improvements that you can see with ESG. Once you hit the point of losing about 10% of your total body weight, you can really start seeing a major reduction and sometimes even resolution of some of the health-related medical conditions that go along with obesity. So that those include things like high cholesterol, fatty liver disease. We see a lot of patients with osteoarthritis or pain in their knees or other joints, patients with PCOS and fertility issues, obstructive sleep apnea. And then some of the other kind of fun non-scale victories that we see, of course, are improved confidence and self-esteem, feeling like you have more energy, and just overall, our patients say that they feel like they're just able to live their life to the fullest, which is really rewarding to hear. So whenever we talk about any procedure, we always have to review the safety considerations. I will start by saying overall, the safety profile of the ESG procedure is much safer than that of a surgical sleeve. The main safety considerations that we really keep a close eye out for are things like gastrointestinal bleeding. We do a lot of different things to prevent this. So we will carefully inspect the sleeve at the end of the procedure to make sure we've addressed any areas of oozing or bleeding. We have our patients avoid NSAID medications that can cause stomach ulcers and bleeding. We give medications to protect the lining of the stomach, like omeprazole. And then we avoid certain stomach areas that can be more prone to bleeding. Same goes for infections. Perforations or tears in the stomach, blood clots, all very, very rare. The risks of these adverse complications are less than 1% in our practice. So very rare, but we just have to let everybody know. All right, so now we'll kind of transition on to talking a little bit about the logistics surrounding your procedure day. So this is a photo of our beautiful office in Atlanta, if you come visit us there. So before the procedure, about an hour before, you'll come to our office, you'll have an IV placed, so for intravenous fluids. You'll get some fluids, anti-nausea medication, as well as an antibiotic to prevent infection. You'll review your medications with our pre-op nurse. You'll meet with your doctor. We will have reviewed everything with you in your consultation prior to getting to our office, but we'll review everything again with you in detail. And then you'll meet one of our wonderful anesthesia providers who will be one-on-one with you during the procedure, making sure you're safe. The procedure itself is relatively quick, takes about 30 to 40 minutes. Our procedures nowadays are taking a little bit longer, 45 minutes to an hour, because we continue to improve our technique and we're able to actually pack in more sutures now. You will be under general anesthesia, so asleep the whole time. Your procedure will be performed by a highly experienced team. This is the only type of procedure we do all day, every day. And then after your procedure is complete, you'll be in the recovery bay for about 45 minutes with a nurse. You'll get any additional IV medications for nausea and cramping as needed. You'll go home the same day of your procedure. So this is a totally outpatient procedure, not requiring any hospital stay. But we do ask that the morning after that you come back to our clinic to see us. We call this hydration clinic. Sometimes after we do these ESG procedures, it can be a little bit difficult to keep fluid down that night. And so we give you a couple of liters of fluid during the actual procedure and beforehand, but the morning after we'll give you some more fluids in clinic as well. When you come to our hydration clinic, you'll also meet with your doctor. We'll review how the procedure went. We'll review your procedure photos. We'll answer any other additional questions you might have and kind of lay out a roadmap for what happens next. And then after that, you're free to go home. This is your procedure day TrueU Care team in Atlanta. So you will meet with your physician, who will either be myself or my partner, Dr. Maselli. You'll meet with one of our great anesthesiology providers, as well as our very friendly and caring endoscopy techs and circulating nurses. We have a great team. And then after your procedure, this is a pretty common question. Patients want to know kind of what to expect. There are some expected yet temporary symptoms that patients will experience after their ESG. I will reiterate that this is a minimally invasive procedure, and some patients do really, really well and have minimal to no symptoms. But we do tell folks to expect things like upper abdominal cramping, which tends to be one of the more common side effects, bloating, gas, nausea. Sometimes patients will experience a little bit of fatigue, and that's primarily because they're on a clear liquid diet afterwards. You'll talk with your nutrition about that, but from just lower caloric intake, and then mild constipation just from being under general anesthesia. We do tell folks that these symptoms will typically resolve within 3 to 5 days, and it's pretty rare to have symptoms beyond 7 days, so pretty mild overall. Other things to expect from your recovery process, we recommend taking about 3 to 4 days off of work just to rest and recover, but most people are back to work around that point. We try to focus on your hydration in the first few days, but again, if you're not able to maintain that, we'll give you some fluids. A really unique part of our procedure, as opposed to surgery, is that there are no lifting restrictions. We are not actually cutting into your abdominal wall or going through your ab muscles. And so you're able to lift, no restrictions on any sort of activity afterwards. And we do encourage you to walk the day of your procedure when you wake up. And then we'll increase your activity as you progress your diet. And really importantly, after your procedure, you'll have the direct contact information of your physician and all of your other providers. So if you have questions at any time of the day or night, you just pick up the phone and you call or text your doctor or one of your other providers. Importantly, we have a really great medical and nutrition follow-up program, and we support you every step of the way. So a very important part of this is obviously your ESG procedure, but even more important as far as long-term weight maintenance and your overall health is to have frequent follow-up with your doctor and especially with your dietitian, because the nutrition component is really huge here too. So you'll see your doctor at the initial consultation. You'll see us the day of your procedure. You'll see us in hydration clinic, and then at frequent visits thereafter. And same with our dietitian. You'll meet with your dietitian a week before the procedure so you can get set up and know what to expect as far as your pre and post procedure nutrition recommendations. And then you'll see them very frequently thereafter, which is really important. We've studied this, and the more follow-up that you engage with after your procedure, the more weight you'll lose. So really take advantage of that. At this point, I think I will turn things over to Laura and she'll talk a little bit about nutrition.
Thanks, Dr. Donnangelo. I'm Laura Sebring. I'm one of the dietitians here at True You Weight Loss. And just a note, feel free to type in your questions in the Q&A box at the bottom of your screen. We're going to address those soon after I go over some of the nutrition follow-up that we offer here. Tonight, I'll be talking to you about our follow-up and what you'll get from your dietitian. You'll see us shortly before your procedure, 3 weeks after, and then again 8 weeks after, and every month. And then for after the 6 months, we'll start seeing you quarterly. Your dietitian can always be contacted between your appointments and for any questions or needs. This way, you are always fully supported. We're here for you all the way. When you meet with us at your pre-op appointment, we'll discuss how to eat before and after your ESG procedure. This will be somewhat different than some eating patterns that you may have heard with traditional bariatric surgeries. Typically, those patients are instructed to go on a liver reduction diet. It's generally 2 weeks long, incorporates specific protein shakes, small meals. The point of that is to reduce the size of the liver so that the surgeon can get around it and have access to the organs on which they need to operate and manipulate. But guess what? With ESG, because you're not having abdominal surgery and your procedure's done endoscopically, you don't need to reduce the size of your liver. So we don't need that liver reduction diet or any diet of any kind for the weeks before your procedure. The only day that you must follow a liquid-only diet is the day before your procedure, just 1 day of a liquid-only diet. After your procedure, you're going to wake up from anesthesia and you can begin drinking as soon as you're comfortable doing so. There's no need to wait. And you'll be aiming for specific protein and fluid goals daily determined by your dietitian. And you'll only be allowed clear liquids the day of your procedure. So once you wake up, clear liquids that day and the following day. Clear liquids just means that they're not milky. Examples are clear protein supplements, electrolyte drinks like Gatorade, bone or vegetable broth. You can even have sugar-free Jell-O, sugar-free popsicles, and of course, water. On the third day, you will go to full liquids, which just means that you can have liquids that do have a milky consistency, like protein shakes, strained soups. You'll continue that liquid-only diet just for the rest of that first 2 weeks following your procedure. And then after 2 weeks, and as long as you're tolerating liquids well, we'll get you started on a pureed food diet. Pureed foods, applesauce, yogurt, sugar-free pudding, pureed vegetables, things like that. Even mashed potatoes, pureed squash. You don't need to eat pureed foods, or you're only going to eat pureed foods for 1 week. And then remember, you can still have liquids during this time as well. It's not just a pureed diet solely in that time period. At the beginning of week 4, you're going to move on to what we call soft foods. Those are fork tender things. Just you can think of things like scrambled or hard-boiled eggs, baked fish, canned or moist cooked chicken, beans, potatoes without skins, overcooked vegetables, even some soft fruits like kiwis or bananas. Crunchy foods, not just yet. At the beginning of week 8, that's when we're going to reincorporate those, and most people return to a regular textured diet at that time. You're going to have our full support and a personalized plan to follow at that point. Next slide, please. Thank you. I wanted to address, we're not going to address all of these, but I mean, unless you guys want to, but we're going to address some frequently asked questions about nutrition and the ESG. One of the most common questions is, what can happen if I don't follow that diet progression that you just talked about? It's for your safety. So we want you to heal comfortably and safely, and we encourage you to treat your new stomach like a baby, starting with liquids and slowly moving to the more dense foods. First, you're going to have some swelling and inflammation where the liquids are better tolerated. And when you were to eat a regular textured food, you most likely would be very uncomfortable, have cramping, feeling of extreme fullness. You may even throw up. Eating foods that are gastric irritants like caffeine, alcohol, they may cause a painful burning sensation. So we want to avoid that and make sure that you're following that diet progression. A lot of people ask us, why can't I drink alcohol? First and foremost, please consider why you are having an ESG performed. You want to lose weight. So alcohol contributes many excess and empty calories into your diet. It can lower your inhibitions, leading to increased mindless eating. Dehydration after any bariatric procedure is a real thing. Alcohol can exacerbate that condition. And like I said earlier, it's a gastric irritant, especially in the beginning. Alcohol also affects your sleep, which is one of the least recognized factors of successful weight loss. And it will affect you differently. It may hit you a little harder, feel more intense than a normal intoxication. Finally, the jury is still out as to whether or not there is a risk of transfer of addictive behaviors from food to alcohol after any bariatric procedure. And the latest research is pointing to this being a reality. So we want to be really careful and consider the risks to decide if this is truly worth it to you. Another question I frequently get is, how much will I be able to consume? Your capacity is going to differ from any other person who has an ESG. So it's important not to compare yourself to other patients that you may see online or social media. ESG, like Dr. Donnangelo said earlier, reduces your stomach's capacity by 70 to 80%, but your 70 to 80 may be different than someone else's who has a larger or smaller stomach in the beginning. We do provide nutrition guidelines that will help you figure out where to begin, and you will increase your intake over time. You can't expect to eat like a bird for the rest of your life. So as you increase this intake over time, it doesn't mean that you've done anything wrong. You'll be eating a reasonable amount of food that will help you sustain your health. By the time, so an idea of what a plate might look like: a nice small lunch plate. You might have 2 to 3 ounces of some type of animal protein, meaning meat, poultry, fish. A cup of vegetables is usually well tolerated and comfortable. You may split that up and have half a cup of vegetables and a little bit of a starch like rice or potato, even pasta at some point. And then as far as fullness, once you do eat that, what does that feel like after an ESG? It's quite different than it is with the typical stomach. It might feel like a slight pressure behind your breastbone, a slight cramp behind the rib cage. Might be as simple as a decent belch, hiccup. Sometimes patients even get a slight runny nose, and that just means stop eating. We don't want you to eat to fullness, though. We encourage eating to satisfaction or satiation, like Dr. Donnangelo said. Eat enough, but not to full capacity. What if I get hungry? My favorite question. Hunger is a cue that is necessary for survival. So yes, the ESG can reduce hunger signs, but we do not want to eliminate them completely. My first piece of advice, if you're hungry, is to eat or drink, depending on what phase of the diet progression you're in. And if you're drinking liquids, drink more. If you're on solid foods, determine if it's true hunger. Did you see something on TV? Are you emotional? Is your stomach truly growling? If so, we want you to eat to that satisfaction factor. More than likely, if you are hungry, you're just not eating enough. A lot of people get nervous about that. And then my final frequently asked question that I like to go over is, what happens if I reach my goal weight? Well, it's not if, but when. And when you reach your goal weight, we're going to meet with your dietitian, make a maintenance plan. It does not mean the work is over. It's just a different kind of work. And your nutrition team is here to support you for as long as you need us. But we'll have time to go over these questions and more in just a bit. But I'm going to hand you back over to Dr. Donnangelo, and she's going to talk about who a great candidate is for ESG.
Awesome. Thanks, Laura. Okay, so who is a good candidate for ESG? So ESG is FDA approved for patients with a BMI between 30 and 50 who have not seen successful weight loss with diet and exercise alone. I will say that many of our patients have tried much more than diet and exercise, including medications and other therapies. If you are outside of that range of BMI, we do consider patients for ESG on a case-by-case basis. So we have the capability to take care of patients with a lower BMI and a BMI over 50. So if you're curious as to whether or not you would be a candidate for this procedure, then definitely have a consultation with us. It's a really great solution, obviously, for patients who do not want to undergo a major gastric surgery, or if they have a condition that makes them ineligible for surgery. Interestingly, only about 1 to 2% of patients who are eligible for bariatric surgery are actually getting bariatric surgery. And so there is a huge need for minimally invasive procedures that patients find more acceptable to help with weight loss. And so that's why this field is pretty exciting. One of the most important criteria also are to be motivated and committed to follow our aftercare program. Again, the ESG is a tool that will absolutely help you lose a lot of weight, but the goal is not to just lose a bunch of weight, it's to lose the weight and then keep it off and maintain that weight loss. And that includes working with your doctor and your health coaches and your dietitian and kind of ingraining these nutritional and behavioral lifestyle changes after your procedure. So really important there. And then important to stay positive and know that there will be bumps in the road. Obesity is a chronic condition, and we're there to support you every step of the way. Here's a couple of keys to success. So number one would be setting realistic expectations. So we already talked about the average weight loss in our practice is about 20% of the total body weight. But again, this is an average. Patients who really follow up and are really motivated will tend to lose more. There are patients who don't follow up as much and will lose less. So there are a variety of factors that contribute to weight loss. It's very complex. Other things factor in, like what health conditions you have, how your sleep is, if you have stress in your life, where you're starting from, what your dietary patterns are. So we'll work with you on all of that, and you can't compare yourself to others. We'll make an individualized plan to help you specifically. Finding an experienced team is really, really important. And I'll talk more about this later, but ESG is a relatively new compared to all the bariatric surgeries that have been out for, decades, but ESG is a relatively new procedure and is very technical, and your success is very much impacted by the expertise of the physician performing your procedure. As well as what kind of aftercare support that you have after your procedure to help you maintain the weight loss. So you really need to look for a center that is high volume and has really strong expertise and a strong aftercare program. And that kind of parlays into the last point, which is, again, take full advantage of the aftercare. We can't stress that enough. ESG is just one part of the journey, and we want you to maintain your healthy weight lifelong. And so we're there to support you with that as well. Next, we have a lot of questions about, from patients about, do I have to be in an exercise program? Perfect. And yes, exercise is really important for your health. No, we're not going to make you do, a boot camp or some sort of rigorous exercise program, but we do encourage our patients to start to incorporate some physical activity into their schedule a couple weeks out from their procedure once they've advanced their diet. We tend to recommend 30 to 60 minutes, 3 to 5 days a week, 2 of those sessions being strength training to help you maintain your lean muscle mass. But don't worry if you've never exercised before, or you're new to exercise, or you're afraid of exercise. We will certainly help you kind of work in ways that are suitable for you and your circumstances little by little. So don't fear that. And then maintaining consistency over time. Again, this is a marathon, not a sprint, and it's, can sometimes be a lifelong journey. And so keeping in touch with us after your procedure, coming to follow-ups, that'll all be really important. Staying positive and being motivated. Those types of patients tend to be very, very successful, although self-doubt can creep in. But if that does occur, then you just know that you have 24/7 access to your team lifelong. So basically, so you can reach out to us for support. That brings me to the true you difference. So just talking a little bit about what makes our practice in particular stand out from all of the other bariatric endoscopy practices that are starting to pop up. I mentioned this earlier, but expertise and experience is just critically important to your success. Dr. Maselli, Dr. McGowan, and myself, we are all triple board certified in internal medicine, gastroenterology and hepatology, and obesity medicine. Dr. Maselli has done additional training in advanced endoscopic procedures. Dr. McGowan and I are both STAR certified in endoscopic suturing, and we are the highest volume center in the country and one of the highest volume centers in the world for these procedures. And the volume and the expertise really matters in achieving the best weight loss outcomes and the safest outcomes. So it's very, very important to carefully evaluate your care team. You'll have 24/7 care access, which I mentioned a couple slides ago, but this is not regular medical care. This is concierge, kind of white glove medicine, where you have 24/7 direct access to your doctor via personal cell phone, text, email, video chat. as well as pretty easy access to your health coaches and dietitians throughout your journey. So that's really special. And then the lifelong follow-up. So again, we keep reiterating that obesity, you know, is a chronic condition, and we want to be with you through your pre-procedure, through the procedure, and then through all of the time thereafter. So we'll be with you throughout your journey. Just to highlight a couple of quick success stories. So this is Rosie. She said that this team absolutely saved her life. She lost about 80 pounds and is doing really, really well. The majority of our patients are women, but we do see men in our practice. So this is Jay, and he said that he just encourages anyone to considering ESG to really give it a go. He lost about 125 pounds and is doing really well. So we're really proud of his success. All right, so that wraps up, I think, the presentation portion. So we can, I'll hand it back to Colleen and we can jump into questions.
Great. Thank you, Dr. Donnangelo. This is the most exciting part for us, is to answer all the questions that you have. That's kind of what we're here for. So we're going to go ahead and start answering questions. Please feel free to use the Q&A function. Come up with your craziest, wildest questions. Our goal is to stump the doctors. No, I'm just kidding, Dr. Donnangelo. We don't want to do that. Okay, we're going to start first with Bethany wants to know if the nutrition visits can be done over the phone. So Laura, I'm going to punt that one to you.
Absolutely. Our practice is virtual for everything but your procedures. So we can do, well, we don't do Zoom, but we do virtual visits, and you will be talking with us one-on-one, face-to-face, and it's at your convenience. You don't have to leave work. You don't have to leave your car. You can talk to us in the parking lot, totally fine. But yeah, we can definitely do everything virtual. You don't have to come in.
Yep, great. Okay, next question is, this one's probably for you, Dr. Donnangelo. If you don't live locally to Atlanta, are you able to, well, this is the same question. Are you able to do follow-up appointments over Zoom? But we did have another question that wanted to know that, do you have to live in Georgia to have this procedure? So I'll let you speak to that.
No, and I apologize. I failed to mention that. That's really important. So you do have to obviously be here for your actual procedure, and the hydration clinic the day after. So we tell patients who are traveling in to plan to be with us for a couple of days. But as far as all the consultation prior to your procedure, the meetings with your nutritionist and health coaches, your subsequent post-procedure follow-up, that is all virtual. So the goal, as I said before, you know, patients do really well the more they follow up. And so our goal is to make the follow-up as easy and painless as possible. And so, yes, you can follow up with us virtually, and that's really the only way we do it. So you don't have a choice.
Perfect. So we have an attendee who wants to know, they don't have a chaperone. And so if they fly to Atlanta for the procedure, do they need someone to travel with you? Because their husband has to stay home with the kids, which I totally understand.
That's a really good question. We do ask that every patient brings with them a responsible adult to their procedure. You'll be undergoing general anesthesia, and so just for your safety, we want you to have somebody with you to bring you home. So you will need someone to come with you, yes.
But we do know some folks don't bring their spouse. They find a friend or an
Yes,
in-law or a
exactly.
neighbor or anybody who wants to just come and check out the area for a day or two. So
Yeah.
Next question is, do we automatically get a health coach? So
That's
Well, I am excited to talk about this, guys. So we do have health coaches on our staff. Dietitians and health coaches are two different occupations, but we do have health coaches on our staff, and we are looking forward to, in the near future, offering the services to our ESG patients. Currently, our health coaches work with our medication patients and our revision patients, but we are looking at upgrading that soon. So automatically you get a dietitian, and one day soon, we're hoping that you'll get a health coach as well.
Great. This question is also for you, Laura. Are caffeine and carbonated drinks to be avoided for a period of time after surgery or ongoing? And I'm going to combine this with another question that someone asked later is, someone wants to know if they are ever allowed to have diet soda again.
Okay, so the big carbonated question. The reason we avoid carbonated beverages is twofold. First and foremost, carbonated beverages contain gas, right? And when gas becomes warm, it tends to expand. So that's going to happen in your stomach. It's going to expand in your stomach. It can make you very uncomfortable. But number two, it can also affect your feeling of satiety. So you can become quite uncomfortable. You can have cramping. You can have that over fullness Thanksgiving feeling, and we want to avoid that. As far as caffeine, so you get the double whammy there with the Diet Coke somebody asked about, but with the caffeine, we're avoiding it at the beginning just because it can be a gastric irritant. You've got some fresh sutures in there. You're a little bit inflamed. We're trying to, cool that off a little bit. You can bring caffeine back into your diet 2 weeks after your procedure. We just ask you to hold off for a couple of weeks, drink some decaf, try to trick yourself into your caffeine fix. But a lot of our patients, they end up quitting caffeine and they feel that they sleep better, they feel better. So that's an option too. As for, is this a forever thing with the carbonation? Yes and no. I mean, this is an investment that you're making in on yourself. So you can determine if you want to go that route or not. Some people can tolerate bubbles just fine. Others, they feel that pain for the rest of their lives. So it just depends on where you're going to end up. But diet soda can also be a slippery slope back to regular soda if that was a habit of yours in the past as well. So a lot of choices to be made, and definitely think about your decisions is what I would say there.
Right. Okay, next question is for you, Dr. Donnangelo. Can you have ESG if you are on or have ever been on a GLP-1 medication, or if you've had a history of a balloon or adjustable gastric band? We've gotten a couple of questions and thrown them all in there together for you.
Yeah, no, those are really, really good questions. So yes, you can get an ESG if you've ever been on one of the GLP medications like semaglutide, brand names Wegovy, Ozempic. The other one was the balloon. You can also get an ESG after you've had a balloon. We do ask that you wait for a period of about 6 months between having your balloon out and getting an ESG if you go that route. And then the lap band, you can get an ESG after lap band as well, but obviously the lap band would have to be removed before we would do your ESG. So really any of those are fine. We would just have to kind of work with you on some specifics.
Perfect. Another question for you, Laura. After the procedure, are you allowed to eat and drink together, or do they have to be staggered like you have to do with VSG?
Good question. Good question. Yes, we do encourage that you don't eat and drink at the same time. Couple reasons there. We just don't want you to get over full. We don't want you to stretch your new stomach, your investment that you just made, and we just don't want you uncomfortable. And honestly, another reason for not eating and drinking at the same time, there's a hormone cue from your gut to your brain. It takes a little while for you to feel that. And if you're drinking on top of your foods, you're not going to feel that. You're not going to feel that cue. So we want you to relearn how to listen to your body. That's another good factor for spacing out your eating and drinking. We encourage 20 to 30 minutes in front and behind of meals.
Perfect. Okay, this one is for you, Dr. Donnangelo. Is there any sort of counseling included or recommended with this procedure? And I assume they mean like the psychological counseling. They didn't clarify, but I'm guessing that's
okay. Yeah. So for example, prior to bariatric surgery, I know a lot of patients are probably familiar with having to go through a psychiatric clearance and a lot of different clearances like that. We don't require any sort of counseling per se before our procedure. If we notice, we do ask questions about, for example, any history of binge eating, which we would work with you in the post-procedural period. We don't want you to have symptoms by advancing your diet too quickly. So we will do a lot of the medical counseling ourselves, but no, we don't require any specific clearances prior to your procedure.
All right. Another medical question for you is, does this procedure help with type 2 diabetes?
It does. It helps with a lot of weight-related medical conditions. So, like I mentioned earlier, once you lose about 10% of your total body weight, we definitely, absolutely see a reduction in obesity-related conditions like type 2 diabetes. We'll see A1Cs come down. Some patients will even be able to get off of their diabetes medicines or reduce the dose. So it can definitely help.
Great. Okay. Are all follow-up appointments included in the cost of the procedure? That's also for you, Dr. Donnangelo.
Yes. So that's another really great feature of our program is that everything is in a package. So you don't have to worry about adding on cost anywhere else down the road.
This is the first question ever that the communications person can answer, but this is, will the slideshow be made available to us via email? And yes, we can absolutely do that. So thank you for that question. Okay, this is for you, Laura. There was a question about straws on the screen. Could you please answer that?
Sure. We discourage using a straw just in the beginning. When you drink through a straw, you tend to drink very quickly. You can also swallow some air, and that could make you uncomfortable. But we do want you sipping very slowly in the beginning. So that is the reason behind the straw. So eventually, yes, you'll be able to use a straw. I would just hold off until the end of the diet progression.
Great. Okay, this one is for you, Dr. Donnangelo. What is the success rate years after the procedure? It might even help to go back to that slide. I don't know, but that's a great question for you.
Yeah, that's a great question. So like we talked about earlier, our practice has actually looked at this internally, and our patients will maintain their weight loss of about 20 to 21% 3 years out of their procedure. So there's a very good success rate with maintaining that weight loss. There are some longer term studies that have come out of Cornell in the past where they looked at weight loss outcomes in ESG out to 5 years. And that study also showed that patients were able to maintain their weight out to 5 years. So I suspect that as more of these procedures are being done and the field continues to advance and we have longer term data, we'll see durability longer out than that as well.
Perfect. Next medical question is the ESG reversible?
That is a nuanced question, but in general, we would say no. So essentially the sutures that we place, you can think of as scaffolding. So the function of the sutures is basically to hold the stomach walls together into that tighter tube configuration so it can kind of fuse and heal together into a newer, smaller stomach. And so after a couple of weeks, the sutures actually aren't really doing a whole lot. And so we don't ever really aim to remove the sutures, nor do we really aim to reverse the procedure because your stomach will have kind of healed into a new configuration itself. That being said, you know, in specific situations, let's say your sleeve were to be too tight and you were having trouble getting food down, there are instances early on where you could theoretically cut one of the sutures and help take part of that out, but that is not something that we routinely do or encounter in our practice.
Great. Here is a question from Valencia. Which doctor has performed the most procedures for ESG?
Which one? Dr. McGowan. So Dr. McGowan is the co-founder of True You Weight Loss in the Cary office, and he trained both Dr. Maselli and I, and he has done more than I think anyone I know. So a lot of good experience here.
Pretty sure he's done more than anybody in the country, but don't have that documented for sure. Okay, Tianci, here's another question I can answer is, do you have an office in North Carolina? Yes, our office is located in Cary, which is not too far, right down the road from Raleigh, if you're familiar with the area. Okay, next question, Dr. Donnangelo, this is for you. Tracy wants to know, I guess she has spoken with the Cary office and understands that they only do the procedure on certain days of the week, toward the end of the week and the weekends. And she would like to know, what days does the Georgia office do the procedure?
So currently we are offering procedures on Thursdays and Fridays, but our practice is constantly changing. So there is a definite chance that we could open up more procedure days in the future. So we'll just keep you abreast of that. If you're signed up for a procedure, we'll work with you.
Great. I love this. So many great questions. Okay. What is considered a successful or unsuccessful outcome?
Oh, that's also a loaded question. It depends on kind of what you're looking at as outcome. For the actual procedure, you will have a perfect ESG done. Technically, we can perform this procedure perfectly every time. But a lot of the actual long-term weight loss outcome will depend again on how much the patient follows up with our aftercare team. So how many medical provider visits, how many nutritionist visits, the degree of exercise that the patient's engaging in, that sort of thing, will all impact how much weight you'll lose. I guess if you're looking at numbers, our average again is 20 to 21% total body weight loss at 1 year. We would consider suboptimal weight loss being less than 5% would be almost a non-response, and less than 10% would be pretty rare too. We don't really see that in our practice. So we don't really like to talk about failure a whole lot, to be honest with you, because patients just tend to do really, really well.
Yep.
And I will say too, aside from numbers, the non-scale victories too are really important. So, I mean, even if you really wanted to lose 50 pounds and you only lost 40, but you're down on your diabetes medicines, or you've reversed your high blood pressure, or you can move more or fit into your old clothes. I mean, those are all really, really important outcomes as well that we would consider to be big successes.
Okay, this one's for you, Laura. Once the stomach is healed, say after a year or however long it takes, are there any foods that you should avoid forever?
Oh, this is one of my favorite questions, y'all. There are no never foods. So you will be working with your dietitian, and we'll be talking about how to eat certain foods, what frequency you should eat them in, what volume you should eat them in. But no, there are no never foods unless you're allergic to them. Don't do that.
All right, back to you, Dr. Donnangelo. Will the stitches, they're actually sutures, I think, will they ever come loose?
Yeah, that's another really, really good question. So in general, we say no, and that's because the sutures are embedded into the stomach wall, and then that stomach wall kind of heals. So again, back to the scaffolding analogy, over time, the sutures really aren't doing as much. It's just your stomach has kind of healed into a new configuration. The one caveat being that we try to make sure our patients really stick to that post-procedural diet really closely, because if you advance your diet too quickly while the stomach is fusing and healing together, there is a chance that you could cause a little bit of pressure or stretch on the stomach at that point before it's fully healed. But in general, no, the sutures are made out of polypropylene, which is the same kind of material that you'd get in any, abdominal surgery. They're really strong. It's very tough to break them or stretch them.
Great. Okay, next question from Dawn. Does insurance cover this procedure?
Unfortunately, no. We are hoping that we'll gain insurance coverage for ESG in the future, because the outcomes are just so good, and it's just such a great opportunity for patients who don't want to undergo bariatric surgery. So hopefully in the future, but currently no. We do have a lot of financing options in our practice. So we obviously want as many patients as we can to have access to this. So we'll work with you and try to figure out a plan that works financially.
Perfect. Do you perform body composition analysis before and after? Why or why not?
That's a great question. We don't do things like, the bod pod or anything like that as far as body composition goes in that respect. We do take waist circumference measurements. We assess your BMI. And we actually do have some research studies coming up where we'll be looking more at some different modalities for body composition. So keep an eye out for those.
Perfect. We have a question about the cost of ESG. If you could just talk about that.
Yes. So we are constantly kind of changing around our pricing. And so we do have some financing options available right now. So I will leave that one vague. When you have a consultation with us, we can talk to you about financing and more about the cost. But okay. You can see it on our website too.
Absolutely. Perfect. Okay. What is the difference between ESG and taking semaglutide?
Yeah, that's a great question, because there's definitely a lot in the media right now about semaglutide. So for those of you who don't know, semaglutide is the injectable. There's an injectable form and an oral form of the new GLP-1 weight loss medication. And so a lot of our patients will come to us wondering which is a better option for me. Should I be on the medication or should I go for something like an ESG? A lot of it is up to patient preference. The semaglutide medication most commonly is an injection. It can be fairly expensive. You have to take the injection weekly. This is a long-term medication, so when you come off, there's a chance for weight regain. So you really have to be in that for the long run. The weight loss is different. So the semaglutide patients, we tend to see a weight loss of around 10 to 15% of your total body weight, as opposed to the ESG, where we'll see about 20 to 21%. Over on the ESG side, the ESG is, a one and done procedure. So this is not something obviously you do repeatedly every week or pay for, every week long term. So, and it has a bit of a higher weight loss. They are both really great strategies, and we need a lot of different tools for a lot of different patients who have different preferences. And so we can even sometimes use these together. But in our consultation, we talk to you about a plan that best suits you. But they're both great.
Great. Question for you, Laura. What is the normal amount of ounces a person will be able to eat after about 6 months?
So like I said, everybody's stomach is a different size in the beginning, and we're taking a percentage of that and tucking it up in there. But like I said earlier, most people can handle 2 or 3 ounces of like some chicken or and then maybe a cup of vegetables with that. Okay. But like I said, you may be able to consume less. You may be able to consume more. We want you to really pay attention to that satiety cue that you're going to get, and know that you're eating to satisfaction, not to fullness. So when you eat, let's say you ate 2 ounces of chicken and 3/4 of a cup of vegetables, and you felt a little, okay, we're going to back off a notch next time, right? That's your cue, your tool telling you you've had enough food. So it does vary from person to person, but like I said, it'll be about, if you look at a lunch, I call it a lunch plate, probably an 8-inch plate. It's going to be covering maybe 2/3 of that is what is going to be comfortable for most people, but everybody's different. So I can't give you an exact number of ounces.
Great. Okay, there are a couple of medication questions, Dr. Donnangelo. One is, can you have the ESG procedure if you were on depression or anxiety medications? And then someone else asking about taking a daily thyroid medication and if that's okay, and sort of how that works.
Yeah, those are great questions. And we would review everyone's specific health history in your consultation. But in general, other chronic medical conditions like depression or thyroid issues, as long as you're following with your doctor on your medications, things are stable and well controlled, that shouldn't be an issue. So you can absolutely have the ESG done if you have other medical conditions that are under good control. And if we find, that some things need a little bit of tweaking, we'll just work with your doctor before the procedure.
Perfect. This is a good time to ask this because we're going to drop a link in the chat to schedule a consult. But Bethany would like to know, what is the typical wait time to get the procedure once you do the initial consult?
Yeah, great question. So typically we can actually get our patients scheduled for their procedure within about 2 to 4 weeks after their initial consultation. So pretty quick. It's also important to note, some people are on the fence. They need more time to think, and consider all their options. And so once you've had your consultation, those are good for 6 months. So if you need a little more time to decide, so on the other end, we can also schedule out a lot later. After 6 months, we want to see you back to make sure nothing's changed in your medical history, but otherwise 2 to 4 weeks. So pretty quick.
Great. Okay. Another question I have, GERD. Can it get worse after the ESG surgery?
Oh, that is a great question. Reflux is a really big issue with the surgical sleeve, but not the endoscopic sleeve. So the surgical sleeve, essentially the surgeons are going to remove part of the stomach, and that basically creates like a high pressure tube, and the stomach acid in your stomach can shoot up into the esophagus and cause irritation and heartburn. With the endoscopic sleeve, we actually leave the fundus or the top of the stomach untouched, and that kind of acts as a reservoir for stomach acid. And so we do not create that same high pressure system that will help push acid into your esophagus. So, and the ESG itself is not an anti-reflux procedure. So it, in and of itself, it's not used to treat reflux, but the weight loss that you will experience after ESG can actually help improve your reflux overall. So less abdominal adiposity and pressure on the abdomen, less pressure for reflux to come up as you lose weight.
Okay, another great question from Valencia. What happens to the excess stomach after the procedure? Does it die or what's happening there?
That's a really good question. So again, we do not remove stomach tissue at all. So there's nothing removed. It does not die. It stays, everything is intact. So really all we do is just kind of scrunch the stomach tissue into itself. So it's every part of your stomach is intact, has a blood supply, and is functioning. It's just smaller.
Okay. Another question, how does nicotine affect this procedure?
Yeah, that's another really good question. So we, smoking and nicotine can impair healing of the stomach lining and can lead to stomach ulcers, which we definitely want to avoid. So we do ask that our patients abstain, meaning no smoking, for at least 6 to 8 weeks prior to your procedure. And then, I mean, ultimately for your health, it's great to, you know, try to cut back as much as you can long term, but certainly in that kind of perioperative period, we want you to be completely off nicotine.
Okay. Are there patients who can act as mentors or a support group before and after the procedure? Laura, I'll let you take this one.
Yes, we have a lot of support here at TrueU. We have a monthly support group, we have education, but a lot of our patients who have done very, very well, they are out there on social media, they are very supportive of each other. And because of the support groups that we have, you can meet people virtually through these. Our support groups are virtual too. And you can meet people here, find buddies, and support each other that way. Plus, you have all of us to support you as well. So yes, plenty of support. And there are a lot of people who are very happy with the results and happy to share with you their success stories.
Mm-hmm. Okay. If you overeat, will your stomach stretch back to its original size?
It's a great question. I think I touched on this a little bit earlier on, but it's just really important to follow the post-procedural diet to make sure that you're on clears and you're slowly advancing your diet. That's the best way to kind of avoid or to get the best result immediately after your procedure. That being said, your stomach is not a steel box. It's not going to just be made smaller and stay that size forever. If you have a surgery, if you have the ESG, if you have any sort of procedure on the stomach, your stomach is very elastic. So there is a chance that over time the stomach can stretch, but as long as you follow the post-procedural diet, you really shouldn't have an issue with that. We don't see that very often at all.
Right. Got time for about 2 more questions. These are so great. Let's see. This one is for you, Dr. Donnangelo. Are there long-term complications with the ESG that you've seen a few years down the road?
That's a really good question as well. For the most part, we don't really see long-term complications. That we tell our patients to expect a couple of days of kind of mild stomach symptoms that we talked about earlier, cramping, nausea, bloating. But on the long term, you know, we're not cutting anything out of the stomach. We're not changing your anatomy. The adverse event profile is really, really low, less than 1%. And so, yeah, we don't really see too much in the way of long-term side effects.
Great. I think this is probably our last question again. Have you ever had a case where the hiatal hernia prevents you from performing ESG?
Also a very, very good question. We can still perform ESG if you do have a hiatal hernia. And the reason for that is we do not suture or stitch inside of a hernia or inside of the fundus of the stomach, which is the upper part of the stomach that can herniate and lead to a hiatal hernia. So we leave that whole area alone. So yes, you can still get an ESG if you have a hiatal hernia.
Great. Well, that concludes our information session. We are literally about 30 seconds from time, so we are so grateful to see so many of you and so many great questions. Dr. Donnangelo and Laura, we have found our dream team. You guys were amazing. If you're interested in booking a consultation with any of our providers, we dropped the link in the chat. You can always go to our website at trueweightloss.com, learn more about our locations and our services, and request a consult. One of our patient ambassadors will be in touch shortly to to start your process. In conclusion, we hope this has been helpful and given you a great overview of the procedure. So thank you again and have a great rest of the week.
Thanks,
Good night.
everyone. Hope to see you in clinic.